Hi, I'm Dr. Rich Sherman, and I'm directing this little chat to primary care providers. I specifically want to get you thinking about why you should refer patients for biofeedback. Biofeedback is a learning process in which patients are shown real-time recordings of physiological systems such as muscle tension. They are taught to recognize incorrect levels and patterns of tension proven to cause the problem being treated. This child has an electronic thermometer taped to her finger. She's being coached to raise low fingertip temperatures associated with onset of migraine headaches. Biofeedback is not magic. Well-known physiological signals are recorded using standard physiological monitoring devices. The output from these devices is sent to a computer monitor for viewing in real time by the client and coach. For example, muscle tension biofeedback helps patients learn to recognize incorrect patterns of muscle tension proven to cause tension headaches, and to correct those patterns. No signals go from the biofeedback device to the patient to change the patient's physiology. Changes occur as the patient learns pattern recognition and control. Many biofeedback-based applications are not experimental. Biofeedback is not new, and for many applications, specific types of biofeedback for specific disorders is not experimental. For example, muscle tension and temperature biofeedback to prevent tension and migraine headaches are accepted by many medical groups as being safe, without lasting side effects, and at least as effective as preventive medications. Several medical groups recommend biofeedback to be the first treatment for these headaches. The following are disorders for which there is significant evidence that biofeedback augmented interventions are likely to work as well or better than medications and other types of interventions for properly selected patients. Migraine headaches of non-traumatic origin. Numerous meta-analyses of large random controlled studies show effect sizes for muscle tension and temperature biofeedback equal or greater than those for preventive medications. Tension headaches, including muscle-based jaw area pain, have similar amounts of evidence, specifically effect sizes equal to or greater than those for other techniques and medications. ADHD, solid evidence from large studies that feedback of specific patterns of brain waves, also known as EEG biofeedback or neurofeedback, is effective. Overall, you can expect about 80% of your patients to eliminate between 80 and 100% of their symptoms. Details of the studies are available at www.biofeedback.org. Other disorders having significant research support for treatment with biofeedback include jaw pain related to muscle tension, TMD but not TMJ, anxiety, Raynaud's syndrome, urinary incontinence among adult females related to muscle tension, epilepsy, constipation related to muscle tension among adults. More info, especially study details, go to www.biofeedback.org. Of great importance, biofeedback is safe and has no significant side effects. Biofeedback is cost-effective in the long run. You don't need to treat side effects, have patients wind up in the hospital, see super expensive subspecialists, and etc. Who offers biofeedback-based services? Biofeedback has many non-clinical uses. Coaches and educators with proper training in biofeedback incorporate biofeedback-based techniques into their work with students, sports teams, businesses, and etc. They emphasize optimal functioning, concentration techniques, and the like. Many Olympic and national level teams use biofeedback. This is absolutely ethical, not to mention quite effective, as long as they don't attempt to treat clinical problems. Clinical uses for biofeedback. Clinical professionals with state licenses working within the scopes of their practice using biofeedback to treat conditions they're actually trained to treat. These folks should have extensive training and certification in biofeedback. These are the people to whom you may want to refer patients. There are also people who have no clinical credentials nor clinical training who offer to treat clinical problems. They usually have little or no training in biofeedback and frequently use machines they call biofeedback devices, but which do not work through patient learning. You may want to avoid these folk. Biofeedback is a complex tool which clinicians from many professions incorporate into their practices. Professionals who do biofeedback include psychologists, counselors, MFTs, nurses, physicians, dentists, OTs, PTs, and many others. Learning to incorporate biofeedback into a practice takes a minimum of 50 hours of classwork, either in person or by distance education, hands-on training in using the devices, and mentoring through the first few patients. State licensed clinicians are certified that they have adequate training in providing biofeedback-based interventions by the Biofeedback Certification International Alliance, BCIA. You can locate local licensed clinicians with proper training to perform biofeedback augmented interventions by going to www.biofeedback.org. Want to know more about biofeedback? Go to, guess what? www.biofeedback.org for lots more detailed videos on biofeedback, for lots of details on efficacy and research, to find out about many more disorders biofeedback works for information for providers, referrers, and potential clients, to find local biofeedback providers, and to find out what AAPB can do for you. Thank you for listening. Once again, if you want further information, please go to biofeedback.org. Goodbye for now.